It's just difficulty being around people.
In my head.
Hey everybody, if you're new here, I'm Ryan Liberty, and my mission is humanizing mental health. So if you want to help me humanize mental health, hit subscribe and hit the bell after you hit subscribe to get notified that every time I do a video. I do them Monday through Friday. Mental health is my topic. Tonight we're going to be talking about social anxiety disorder symptoms. What are they? What do they look like? What do we do about them? It's all important. Let's go talk about them. A little windy out today, you'll have to forgive me if there's any noise. So social anxiety, we know what social anxiety is, we all experience it, but when it becomes social anxiety disorder is when it's something that persists for 6 months or longer. And in children, it can't just be social anxiety around adults, because that's sort of normal for children. It has to be around their peers. Now, before we look into what social anxiety is, I just want to clarify, you can't necessarily know that you have it yourself, because you may over-evaluate the importance of a specific situation and think that your reaction to it is out of proportion, when it's really not. People who have social anxiety have difficulty judging whether or not their reaction is out of proportion to begin with, so you need somebody else to step in and say, yes, this is over-exaggerating, what you're afraid of here is a little bit more than you should be, and it's not culturally appropriate to what your culture is. So a quick example would be if you're in high school, it might be normal to feel social anxiety when another group that you're not a part of comes up and approaches you. That's a situation that's a little bit fearful, and it's appropriate to the culture that you're in of the American high school is what I'm picturing in my mind. So you have to see somebody else to have this diagnosed, and let's talk about what it is. So what are these symptoms of social anxiety? Well, one of them is obviously avoiding social situations. So the anxiety in general is just the fear of something that hasn't necessarily happened yet. And when we have social anxiety, we're afraid of other people. And specifically what we're afraid of is being negatively evaluated by those people and judged and criticized. And sometimes this looks like being afraid of offending other people. Sometimes it looks like just being afraid to go into situations with other people, but sometimes it doesn't look like that. So, a lot of times we think of people who have social anxiety, they avoid situations, and that's very true, and that can progress into avoidant personality disorder. But it also could look like getting into social situations and talking a lot and just bearing through the stress and the anxiety that those social situations bring. There's actually a specifier under social anxiety disorder for performance-only anxiety, in which social anxiety only shows up in performance-related activities, and that would be somebody who has a job where they constantly have to be on stage or talking to people. And of course, since this has to be 6 months or longer, that would kind of be the only situation where you would have to do that, and the anxiety only shows up in those situations. But generally, when we're talking about social anxiety, it's just difficulty being around people because you're stressed and you're afraid of being judged, and you're typically afraid of being judged for saying the wrong thing, looking at somebody the wrong way, looking at them too long, sweating, maybe you feel dirty, you feel disgusting, people are going to think you're ugly. Whatever it is, there's something in your head saying I'm not okay, people can see that I'm not okay, and it may even be related to social anxiety itself. You may think they can see that I'm uncomfortable, and that makes it worse. I think what's really important to understand about social anxiety disorder is that these are negative evaluations that we have in our own head. It's not necessarily that other people are evaluating us negatively or judging us or criticizing us. They may have in the past, but typically the social anxiety disorder that we're experiencing is all happening within ourselves. It's not happening from outside of us. We have to be aware of that if we want to seek treatment for it and start to work on it. Now, before I left, I was reading, and I believe it was 70% of people from Australia who have social anxiety disorder also have another disorder on top of that. And you could see how with post-traumatic stress disorder and the overactivation of the amygdala, especially when we've been through abuse with people, would make you feel anxious in those kinds of situations. Typically also people with social anxiety disorder, they turn to a substance like alcohol to make them feel better in social situations, but that can actually make things worse, because when we grab for alcohol, we start to change the way that we react to things, and the social anxiety inside of us makes us think oh no, people can see that I'm acting differently, they can tell that I've drank, and it just makes things worse. So don't turn to a substance as a means to avoid what's going on or to try to treat what's going on. There are treatments available, and you want to see a therapist for those. Now I'm going to give you some tips for what you could do about social anxiety disorder, but first I want to talk about treatment because I know a lot of people with anxiety disorders, they don't get into treatment. I think the statistic is that the average person with an anxiety disorder doesn't see somebody for treatment for 10 years, so they live with it for 10 years, and that's terrible because then it just festers and it gets worse. So if I can encourage you to get into treatment and get you to see a therapist, I'm going to do that here. Now there's a lot of different things that you can do when it comes to social anxiety disorder, a lot of different treatments available. Primarily when we talk about anxiety disorders, we're going to look into exposure therapy. And exposure therapy is a form of getting you to face these feelings of anxiety and not just face them and like challenge yourself. That's part of it. I don't want you to feel afraid that, oh no, you're going to like throw me into a social situation. It doesn't have to be so dramatic. You can do it in very, very small steps. But the idea is to get you used to these situations, even maybe just starting with imagining them in your head or being in the room with the therapist and practicing them there so that it doesn't seem so scary when it comes to social situations, and they're things that you can handle, and the stress that comes up and all those fears start to quiet down, and then eventually, gradually, you can step back into those social situations that you were afraid of in the first place. So hang in with me, I'm going to give you some tips. Now there's a lot of different ways that you can handle anxiety besides just exposure therapy. There is interoceptive exposure therapy, which I recently talked about in a video. There's dialectical behavior therapy, cognitive behavioral therapy, so don't feel like you're locked into just that. There are so many different ways to approach this, and everybody has their own individual situation. So what are some tips that I can give you? The first thing is that since social anxiety disorder is all about negatively evaluating yourself, it means that the attention is constantly on yourself. So if you can start to take that attention off of yourself when you're in social situations, that's going to help to relieve some of that anxiety. So maybe paying attention to the things that are going on around you and not necessarily directing the attention towards yourself and those thoughts that run through your head about yourself, because remember, it's not that somebody else is negatively evaluating you, it's that you're negatively evaluating yourself. That would be one thing to do. Something else to do would be to actually listen to the person that you're talking with or to the people that you're talking with and focus on their experience. So a lot of times when we have social anxiety, when we're talking with somebody, we feel like we're not really listening. We're actually thinking about what we're going to say next or how we're going to appear to the person. If we can stop that, switch it off for a moment, and actually listen to the people and actively try to hear what they're saying, that will help a lot. So if you're somebody who has trouble with self-esteem, I have free worksheets up on my Patreon page. You can check those out. They're not a substitute for therapy, but they may be able to help you in addition to therapy. They're free. I'll put the link up above. And if you want to support me in my mission on humanizing mental health, you can do so over there as well. Just as a reminder, if you're new here, I do mental health videos Monday through Friday, so hit subscribe if you want to see them, and hit the bell afterwards to get notified every time that I do one. And I'd love to hear from you. If you have social anxiety disorder, if you experience social anxiety, maybe you know somebody who's gone through it, what has helped you? What has your experience been like with the disorder? Leave your tips down below for the people who are here so we can learn from each other. And as always, thank you for being here. I appreciate it.